With that, we are going to call our first witness, which is David Doonan, the mayor of the village of Greenwich, not to be confused with Greenwich Village. Or Greenwich, Connecticut, right. Good morning. Do you swear or affirm that the testimony you're about to give is true?
Yes.
Thank you.
Okay, thank you, Assemblyman and Senator, for the privilege of being able to address you. Hopefully this will be the year in which we'll be able to fulfill Teddy Roosevelt's vision. I believe he was the first one that talked about universal health care. The single greatest thing the New York State Legislature can do to lower property taxes would be to implement a statewide single-payer health care system. Health care costs take up 9% of our annual municipal budget. Implementing a statewide single-payer system will not eliminate all of those costs, but we can't expect to see the health care budget line decrease dramatically for all local governments. It then becomes the responsibility of local officials, such as myself, to make sure those savings are passed on to those we represent in the form of tax reductions. Implementation of a statewide single-payer system would have another significant effect on local municipalities. We've been told that for years New York State businesses are at a competitive disadvantage. Implementation of a single payer will change that. New York businesses would finally find themselves on a level playing field with foreign competition, as the United States is one of the few countries with a health care system primarily paid for by employers. New York businesses will also have a leg up on businesses located elsewhere in the United States. As local businesses become more competitive, local tax revenues will increase, thereby lessening the tax burden on property owners. As local businesses become more competitive, more jobs will be created for New Yorkers. Implementation of a statewide single-payer system will create a healthier New York, a New York that will be able to provide universal health care in the most cost-efficient way possible, as well as creating the environment in which our businesses can thrive. Thank you.
Thank you very much. The 9% figure that you cited, the 9% represents public employee health costs?
It's the cost for the employees and the elected officials that participate in the healthcare system that we have.
And that's for local governments statewide?
No, it's strictly for the Village of Greenwich.
Oh, okay. Okay. Other questions?
Just a brief question.
Sure.
Thank you. You do know it's not free, though, so there's an assessment based on how this works.
Yep.
So not knowing what that assessment is, how can you say that you're going to save 9%?
Well, we would certainly expect a reduction if the overall costs are going to decrease. We're in a situation where almost every year we're facing significant increases with the health care premium to the current system. In 2009, the state legislature, with the direction, I believe, Governor Patterson, conducted a study on the different ways to implement health care savings, and single payer came out by far and away the most cost-effective way to do it. And I believe the figure was, if they implemented it in 2009, the cost reductions to New York State by 2019 would be $20 billion. I'm sure those numbers are going to change over time as well.
Okay, thank you.
Yeah, but again, we don't expect our health care costs to go down to zero. That's what I indicated. But we would expect a significant reduction. So, thank you.
Oh, Mr. Steck has a question.
What county are you in?
Washington County.
Does your county have a self-insured health plan for county employees?
I don't think so, but our village went to that 3 years ago, and it actually saved us quite a bit of money the first 2 years. The third year, we're kind of plateaued. But every year, the money that we allocate in that health line, in the budget line, is not totally appropriated. So we're able to roll a little bit over every year. Also, we did had conversations in town of Greenwich to look into a common health insurance policy for both of us, hoping that we would be able to lower costs that way. Unfortunately, we couldn't find a health insurance company willing to write one policy for two different municipalities. So we have been actively looking for ways to reduce that.
Okay, thank you.
Thank you.